Okay, I guess we're ready to go. My name is Timothy Mulrooney. I'm a professor and graduate coordinator at the Department of Environmental, Earth, and Geospatial Sciences at North Carolina Central University. And here we're ready for the first session of the G. Herbert Stout Awards for undergraduate and graduate students. First one is one of students from NCCU and one of my advisees, and this will be Mike Wallace, and the title of his presentation is COVID-19 Rates and Proximity to Meat and Poultry Processing Plants in North Carolina.
Thanks for that warm welcome. Let's move into it. So, as you know, it was covered at the time, and maybe familiar. Here's a map from April 2020 from a piece by Investigate Midwest showing COVID-19 outbreaks at meat and poultry processing facilities across the nation. These were some of the earliest sites and some of the most widespread outbreaks in workplaces. Here you can see North Carolina. You have to get real close, but there's several in our state at that time. The biggest one is a plant outside of Wilkesboro, or in Wilkesboro. And then a November 2020 study later on found that almost 6 to 8% of the total cases of COVID were associated with livestock plants, meat processing facilities, places of that nature. Early in the pandemic, many other business industries halted. Meat processing and the livestock industry was different because they were deemed essential, but also because there was industry and lobbyists kind of wrangling behind the scenes, and there was government mandates, not only at the federal and often the state level, keeping these plants open and not subjecting them to the same restrictions or safety regulations as other industries that are working at other central industries. Here's a copy of the President's executive order, the Trump administration at that time, compared with a draft executive order from the North American Meat Institute. There was this is from a ProPublica piece, but you can see that there's a lot of coordination here in keeping these plants open and open at full capacity, knowing that they did not have PPE equipment or any kind of safety regulations to keep these workers safe at that time. The meat industry, like most other essential industries, had known for a long time that there was a pandemic on the horizon. As early as 2007, industries were gathered together and told to prepare for this contingency. And we can see from the data and from our own experience that there was very little preparation done to keep workers safe and to prevent the spread of of infection there. So at this time too, there's John Tyson of Tyson Farms, was taking out newspaper ads, saying that to feed America it's as essential as healthcare, and this is also that giant dot here, the Wilkes-Barre plant is a Tyson plant, so is. I'm already there. And here's another piece from the Wilkes-Barre plant. Ken Nolan, the town manager. This is just kind of illustrate that the federal mandate was a major issue. It was at least used as a justification to keep plants open and to keep workers on these facilities producing meat and exposing them. We can see from the data, exposing them to high risk and a lot of infection from COVID. So anyway, here's asking who these workers are. Data's not just numbers, it's people. So you can see from this graph here, the majority of all positions in the workers in the animal slaughtering processing industry are non-white workers, and almost half in the front line and packing and handling are foreign-born. And this is a trend that that is continued since the 1950s of both industries moving from more urban settings to more rural settings, and industries employing more immigrant and more recent immigrant workforce, primarily Latino in most areas. And in North Carolina is exactly on that trend. Here's some more demographic data here. And this is just looking at slaughterers and meat packers in particular, not all the other positions we just looked at. But you can see North Carolina has the highest number of workers in that BLS classification, earning an hourly mean wage of $15.45. So looking at the work here and the people involved, we have what's widely understood as a dangerous and demanding job, performed for lower wages and by an increasingly precarious workforce that was not able to, was non-unionized or was not able to effectively organize to insist upon protections, and was not in a position to, economically to not participate in the workforce there. So, kind of all this background to get to kind of where our research goal here. We saw the first map where, these outbreaks are, graduated or, larger and having community impact. And, there's been a good deal of study into this area. But for the purpose of this project, we want to look at what scale or is community impact measurable in some way? Can we see if these early outbreaks had impact on the surrounding community, and were there trends that continued? The thesis here is that areas closer to meat processing and slaughtering facilities will have higher average COVID rates than areas further away. And, we can use some very simple GIS and geostatistical analysis to investigate these kind of correlations and use publicly available data to be able to say something about this topic. So looking at the data used here, the facility locations were located with this USDA beef, poultry, and egg inspection map here. So this is all the facilities regulated by the USDA, North Carolina. There's 212 here on this map. This map includes production category, species, number of employees. To get this, for the purpose of this study, we just focused on the largest facilities, or designated large by the USDA here. So we have 24 plants, and that's plants with 500 or more employees. Includes, Smithfield, Tyson, Purdue, Mount Ayr, Pilgrim's Pride, JBS, among many others. So these are USDA inspected plants, but North Carolina, like a few other states, is not. These facilities are not OSHA regulated or inspected. Most of the country is. North Carolina is not. So it's another way that these workers were failed, and that impact is potentially felt not just within those communities, but can be far outside. So for the COVID data here, we're just using the North Carolina Department of Health and Human Services COVID dashboard. We're looking at COVID at the zip code level. That's about the smallest scale, kind of widely available. And this is the bottom, just kind of shows you some of that. This case, a COVID-19 case, is defined as a person that has received a positive test result. A person is considered reinfected if they have a new positive test at least 90 days after the initial test. And this reinfection is counted as a case on the dashboard, and that began in October of 2021. in these cases, they build, they can never go lower. They're always building as positive tests are confirmed. So this ends up being, I don't know, kind of a digression, I guess, but thinking about the distance and how to establish that for the course of the study, looking at data from the North Carolina Department of Commerce and commuter data. So this is, overall the trends are that people in larger labor markets tend to stay there, and people in smaller or more rural labor markets tend to travel further for work or into larger markets. And just under half of all workers statewide live and work in the same county. The average commuting time is about 24.8 minutes as in 2018. So thinking about, so first, we're taking this data and putting it into ArcGIS Pro and running some real simple tools. The facility locations geocoded with the rural geocoder. A spatial join of the COVID-19 case rate data to a zip code polygon layer. And you can use the select by location tool to find the zip codes around the facilities. For this study or this project, it shows 5, 10, 20 miles. At 30 miles, you're getting over half of all the zip codes, and further out, you're kind of, it's not such a, it becomes harder to see differences in the means there. So here's a map of those plants and just a quantile population map. I guess this to me is kind of helpful or illustrative of just not just mapping the population, or you're not just like getting areas where population's higher, so you would assume that rates would be higher. There are some areas where plants are located in higher population counties, but yeah, there's others that it's not. And you can see a lot in the kind of southeast part of the state, but somewhat kind of an even distribution. So after taking all that data, selecting those zip codes within those mile radiuses, you can look at these maps or have these. The top is 5 miles. You can see 10 miles, 20 miles. Clearly expanding out and covering a lot more ground there. And then here's a map of similar to the quantile map, but this is of COVID cases. And for this presentation, we're just going to look at a couple different snapshots, one at the beginning, one at the end. We had essentially monthly snapshots of data throughout 2020 into 2022 that we're looking at, but just instead of showing all of them, we'll just do a couple of them. So here's this. You can see the concentrations around some of the plants even early on, and then we go to later. COVID has moved throughout the state. This is in October 22, a little under 2 years later. And see, you can see some changes there as it's moving throughout the state. It's moving throughout different zip codes here, but we really need to do kind of a statistical analysis to see kind of what's going on here, or what we can say if there's any correlations. So the next step of this project, we export the table from ArcGIS, and we're using Excel data analysis tools here to do this analysis. From the excuse me, from the table in ArcGIS, we're able to establish which zip codes were within the mile radius and which were out, creating 2 groups to study, and running a 2-sample t-test in this case allows us to compare the average rates of each of these 2 groups. And this was done for each group at every COVID snapshot and at every mile radius throughout here. And this is just these tests here with these p-values highlighted here, which is what the tool we use to assess. And in every instance, virtually, we're well under the threshold to reject the null hypothesis. In this case, that there is no statistically significant difference in cover rates between zip codes within 20 miles or 5 miles or 10 miles and those without or outside there. Another way, here are some results in table form. This is for zip codes in 5 miles, so the closest zip codes. And the first one is in July 2020, and the second is from 2022. You can see that cases have certainly have gone way up in that time. Overall cases counted, but remains a real difference here in the average cases, and it maintains that throughout the study period. Just to go back here quickly too, you can see the number of observations, which is like the number of zip codes there, is in some cases in with 5, in the 5 mile versus all the other zip codes, it's much smaller number of zip codes, yet still we're seeing at least statistically significant difference in these average covered rates. And this is for some similar graphs for zip codes at 20 miles radius from the meat and poultry processing facilities here. The same was true for 10 miles as well. These trends continued, and we're still seeing long after COVID had moved throughout the state and had traveled there and changed numbers throughout. Concluding, we can say that each monthly kind of data point or snapshot between this period, there is a statistically significant difference in mean cover rates between zip codes that are closer to these processing plants and those at a greater distance, and that there was found to be that significance was found at every mile radius here, indicating that there is impact and measurable impact from localized or workplace outbreaks and workplace regulations on the wider community. I guess partly it's also illustrates that there is not only a cost for cheap meat and cheap products for the people involved in making them, but a cost for the larger community as well. And I guess too, everyone kind of has COVID fatigue, or maybe not. I know I have been tired of thinking about it in a way, but this was something that was just updated in February this year, last month. And why it's still important to kind of keep thinking about this stuff is that emerging evidence here is saying that COVID's going to have long-lasting effects. We'll deal with these consequences in a public health sense for a long time, and we're not even really sure what all that means right now. But I guess that's kind of why it's important to still think about, or why I wanted to kind of look at it. This is a shot from the Mount Air plant in Siler City, and that concludes this brief talk. We'll take any questions. Oh, hello.
Did you guys look into if the different plants across the state were following, or at least pretending to follow, similar safety guidelines?
No, not specifically. I mean, outside of not like an organized way. I mean, outside of just kind of reading news coverage and other articles, but not in like a systematic way. I think that'd be interesting.
You mentioned that some of the processing plants were in more
That's interesting, but that's I guess that would be a good next step. That was kind of outside the scope of this. But yeah, I don't know. I'm sure there probably is or something there.
Any questions?
All right.
Thank you very much. We've got about 6 or 7 minutes before we start the next one. So thank you.
Cool.